on behalf of the West Virginia Higher Education Policy Commission, as well as the West Virginia Community and Technical College System and Chancellor Sarah Tucker. Welcome to the Roadmap to Behavioral Health Careers in West Virginia conference. At the commission, we immerse ourselves in work that transforms West Virginia by developing the most competitive and capable graduates in the nation. This conference is aimed at just that, helping you make the decision about how you can transform West Virginia by choosing an educational pathway that will lead to a career in behavioral health. As you may know, West Virginia has a higher percentage of residents with behavioral health and substance use disorders than most states in the nation. Part of the issue is that we don't have enough behavioral health providers to provide essential care to our citizens. Workforce shortages at mental health providers have long been a concern for West Virginia, and severe workforce shortages for inpatient as well as community-based services have really been exacerbated by the stressors associated with the COVID-19 pandemic. We were talking before all of you joined the room about how it's the worst that we've ever seen in terms of having enough professionals to take care of our communities. And this need is predicted to continue for many years in the future. So for some of you, behavioral health and the term behavioral health might be a new one. And for some of you, it's what you've immersed yourself in. I've seen a lot of high school students as well as a lot of graduate students on our chat board. So I'm going to start from the very beginning and talk about what is behavioral health anyway. Today, you'll learn that behavioral health is the promotion of mental health, resilience, and well-being. It's the treatment of mental and substance use disorders and the support of those people who are experiencing mental health or substance use disorders or are in recovery from those conditions. And we're also caring for their families and our communities. The behavioral health field spans a wide variety of careers with many roles that require advanced degrees and specialized training. The behavioral health workforce is often used to describe the trained team members who provide prevention, treatment, and recovery services to address mental health and substance use problems. Some of the important roles in behavioral health care are psychiatric nurse practitioners, physician assistants, psychiatrists, pharmacists, as well as others like peer support counselors, child welfare workers, prevention specialists, drug and alcohol counselors, and others. However, this conference is very specific to pathways for the careers with the greatest workforce needs in West Virginia, and they include psychologists, counselors, and social workers. Some populations are at higher risk for mental health conditions, and having representation from all communities in the workforce is one way to help reduce barriers to people getting the help that they need. We're glad that you're here. Behavioral health needs you, and we need a more diverse workforce to work toward reducing mental health disparities. So welcome and thank you. For your interest in a behavioral health career, we thank you. You're right where you need to be in order to find out how to launch your career. You're embarking on a wonderful career journey with the potential to help others transform, recover, and thrive. As you'll hear today and tomorrow, you'll hear from students already on the journey, faculty who can mentor you, and practicing healthcare providers. You'll hear that a career in behavioral health is attainable with many options for financial assistance for your education. We're here to help you and to facilitate your success. Remember what we do. We create the most capable and educated workforce in the nation. We want you to get you across the finish line for your future to transform West Virginia. So it's now my pleasure to introduce to you Gerard Schmidt, who will kick off our conference. Jerry is the immediate past president of NADAC, the Association for Addiction Professionals, and he's the Chief Operations Officer at Valley Healthcare System in Morgantown. He has served in the mental health and addictions treatment profession for the past 48 years. Publications to his credit include several articles on the development of employee assistance programs in rural areas and wellness in the workplace, addictions practice in residential settings, and an overview of addictions practice in the United States. Jerry has served as chair of the National Certification Commission for Addiction Professionals and NADAC's Public Policy Committee, and as NADAC's Clinical Affairs Consultant. He's received several awards in his distinguished career, including the Distinguished Service Award in 2003 and the Senator Harold Hughes Advocate of the Year in 2010. Please join me in giving a hearty welcome to Jerry for his remarks. Welcome, Jerry.
Thank you, Cynthia. Wow. Sounds like I've done something over the past 50 years. I appreciate that. I want to welcome everyone as well. And we were talking before we went live just about all of the gaps that we have in terms of positions, not just within my own agency, but across the entire state. And unfortunately, West Virginia leads the country in a statistic that we really don't necessarily want to lead the country in, and that is the number of overdose deaths related to opioids. But we also lead the country in the fact that we have a depleted workforce. And I want to just share with all of you just happenstance how I ended up 50 years later still in this profession. I can honestly tell you that when I walked into my first job working for the then Department of Mental Health for the state of West Virginia in Clarksburg on January 3rd, 1972, fresh out of undergraduate school with a degree in psychology and sociology, I was ready to set the world on fire. Didn't really know a whole lot about what I was doing at that point, but I did realize early on that I didn't have enough tools in my toolbox. So continued working full-time, enrolled in the School of Counseling Psychology at WVU, and 4 years later had a master's degree. It was happenstance that I ended up in behavioral health. My family knew someone that ran a local community mental health center in Clarksburg, went in there and ended up finding my place in life, so to speak. Where it's interesting for me, at least, to reflect back on all of the people that I became engaged with over these past years, and how beyond my education, how that has really helped grow and mentor me into the professional that I've become. It doesn't sound like I work directly with people, being a chief operations officer. What happens to you when you're in this business as long as I have? They kind of pull you into the developmental side and the supervision side. But I'm blessed, though, that I get to help structure and build programs, and have done that a good part of my professional career. I do have a private practice that I work in my off hours, which really gives me that connection with clients that I feel I need, and has kept me fresh over all of these years. But one thing I would like to share with you, there's so many opportunities from an entry level where you might be working as a behavioral health technician or a residential assistant in a substance use disorder program. You might have your own lived recovery and be working as a peer recovery support specialist. You might have a master's degree and gone on and gotten licensed, and you could be a therapist. As Cynthia said, there's looking at it from the primary care side, you could be a nurse practitioner or a physician's assistant, all the way up to being, a licensed psychologist or even a psychiatrist. There are so many points of entry, and there's so many different places that you can grow into this. And what I found over the years that I've been at this, while it's, it may not quote unquote be the sexiest profession to get into, oftentimes it can be thankless. But what I can tell you is you're not going to get necessarily rich, but you can make a good living at this. But the rewards that you get from being involved in an effective tool and helping people change their lives, to me, has been the most rewarding factor that I think has kept me engaged over all these years. And you can do it right here in West Virginia. We need to keep our treatment professionals here in West Virginia. There's a need nationwide. And I found this out over the years. I've been blessed in being able to be involved nationally and internationally, and have trained, in Iceland, Puerto Rico, South Africa, Hong Kong. I've been fortunate in that respect. But one thing I found out in going to all those places, their problems are the same as ours. Their treatment approaches might be a little different, but I think the thing that is rewarding for me is that the problems are the same worldwide. How we approach them maybe from a national standpoint might be different, but you can come all the way back to West Virginia and the problems are the same. The blessing here is that being a smaller state, our resources are compacted, and so we can reach out across lines. And Cynthia and I know this from our work that we've done over the years, where the different organizations we've been in are, in different parts of the state, but we can reach out and touch our colleagues, where in a larger state, you don't really have that opportunity because you may not know who is in a city across, let's say Texas or Oklahoma or Montana, where in West Virginia, we have the capacity and the ability to connect, which really helps us. What I would encourage you over the next couple of days is to listen to where you might be able to enter this profession. I can unequivocally say it has been my life's profession. I feel I've been blessed with all of the people I've had the opportunity to work with, and I'm talking about other professionals as well as the clients, the families, and other professionals over these past 50 years. And we need you. I can't retire because I need somebody to take my place. So it's up to one of you out there to step forward. But we seriously, we need you. We need young blood coming into the behavioral health profession at whatever level you come in and whatever discipline within behavioral health that you choose to work with. So I applaud you for being here today. I want to thank Carolyn and Cynthia for the opportunity to share my experiences with you. Thank you. Enjoy the next couple of days.
Thank you so much, both to Dr. Pursley and to Mr. Schmidt, for the wonderful welcome. I'm so happy to be here today. My name's Carolyn, and I'm going to be the moderator for the rest of this session, which will be the Student and New Professional Perspectives, Why Behavioral Health Needs You. During this session, we will hear from one student and two recent graduates, and our student is very, very close to his graduation. But we'll be hearing about their experiences and their perspectives on the behavioral health field. Each of these students was a recipient of a competitive master's internship stipend, which was made possible by the West Virginia School of Osteopathic Medicine's Center for Rural and Community Health and the State Opioid Response Grant last year. You can learn more about all the students in this internship program on our Career Pathways video series page, and I'll show you a little bit more about that a little bit later today. But for now, I'd like to briefly introduce each of our panelists and then give each of them a chance to share a little bit more with all of us about their career pathways and why they're excited about their new careers in behavioral health. So first of all, we have Olivia Higdon. Olivia has worked for WVU Medicine at the department. And Olivia, if you want to just give a wave so everyone can see where you are. Olivia has worked for the WVU Medicine at the Department of Behavioral Medicine for 8 years in total. She started working there right out of undergrad on the inpatient psychiatric intensive unit as a mental health specialist. And then she went on to continue working there and pursued her MSW, which she just graduated with in August. And now she has transitioned to an associate clinical therapist role, where she uses the rapport that she built over those years before she received her master's to connect with her patients, to help work through stressors so that each one can be the very best version of themselves. Next, we have Sheba. Sheba completed her master's from the WVU School of Social Work in fall of 2021. She is currently a data entry assistant with Milan Pusker Health Right in Morgantown. And in her spare time, she enjoys reading, writing, and connecting with friends and family. And our third panelist is Ellis. Ellis is a student in the first cohort of the Master of Arts in Clinical Psychology at West Liberty University. Ellis is set to graduate this spring and has various different experience working in the SUD treatment field. So it's great to have each of you with us today to share your perspectives as you enter the field. And so I'm just going to ask our first question of the panelists. Why did you choose to pursue a career in behavioral health?
So, hi, it's Olivia here. I will go ahead and try to tackle this one a little bit. For me personally, I really didn't choose a career in behavioral health. It kind of chose me. Originally, when I was in school and trying to figure out what I wanted to do, I was in a science related field. I was trying to go into forensics, but through life experiences and different things, I found that I was more drawn to working with the behavioral sciences. And then I got into my BSW internship, and that's where it just all kind of came together. Through that, I just kind of found that I really, although I never ever wanted to go into substance use treatment, that's where I found that I did the best and felt the most comfortable. And I really, ever since then, that's what I've been doing in different capacities and working in behavioral health. And I also do a lot with thought disorders, which I found out through my first job out of grad school. But I didn't really want to do any kind of behavioral health for the longest time, and it just kind of fell into my lap, and I love it.
That's great. Thank you, Olivia. Mm-hmm. Would one of the other panelists like to answer that question?
Yeah, I can go next. My name is Sheba, and I feel like I have always had an interest in like brain science and just sort of like why people do the things that they do. Always had questions. And I also feel like my family and cultural background had a big influence on me choosing behavioral health as the field, because they would often talk about wellness, and also our cultural background. So both my parents are South Indian, and so the culture is very much rooted in wellness. And so that was like something that was very important, understanding the connection between mind, body, and spirit, seeing that as one entity, not seeing it as separate, and also understanding the ripple effect of how our actions affect our, not just our like behaviors with other people, but our behaviors inside of ourselves, so our thoughts, our emotions, our feelings. And also I felt like growing up, I I've always been empathetic, and I've always kind of found it easy to talk to people. So I felt like counseling or, psychology, that sort of realm would be more of like what I would want to do. And along with that, not seeing a whole lot of representation of BIPOC people in West Virginia, I think is also one of the main reasons. And the last reason would be that I struggle with depression and anxiety myself, and I am recovering from a lot of trauma. And so I feel like it's really important for me to share my voice, so that other people know that they're not alone.
Great. Thank you so much for sharing that, Sheba. And now, Ellis, would you like to answer that question as well?
Sure, I'd love to. So I have a little bit of a different introduction into the field of behavioral health than my fellow panelists. I wanted to be a history teacher. How I got here, your guess is as good as mine. I grew up in a small town where mental health was not talked about, nor did people ever seek out help for any mental health issues. For those that did choose to seek out help, there was next to none to be found, whether it was lack of providers, lack of quality care, long wait lists, far commutes to services. I grew up about 45 minutes outside of Pittsburgh, actually in Ohio. So if you really wanted to find quality healthcare, you had to go to Pittsburgh, you had to go to Columbus, you had to go to Cleveland. There was just a severe lack in the area, and kind of similar to, I believe it's Sheba. I don't want to say your name incorrectly. I, as a member of the LGBTQIA+ community, the amount of providers that really understood what that meant was even less than zero. If that's possible, they found a way. So, as a transgender man going through this graduate school experience, it's been very interesting to see not only, as a supervised psychologist, the implications with that and working with my own clients and the impact that, I've been able to have on people with just, my own understanding of the lack of resources and lack of access to care. When I was after I finished my undergraduate degree, I worked for 2.5 years on a crisis stabilization unit, dealing mostly with acute mental health care and substance use disorders, which I never thought that I would enjoy working with, and I did. So it's just been a very eye-opening experience along the way. And, while I wanted to start somewhere else, and I really wanted to, at one point in my life to teach history, I think that I've found the place that I am meant to be. And that's kind of where I stand on all of this.
Great. Thank you so much. Thank you each for sharing those really personal journeys that you've had into this field. I think a lot of our attendees can probably see themselves in some of your stories that you've shared and some of the reasons that you've chosen to pursue a career in behavioral health. Next question that I want to ask to the panelists are, you started to touch on this, and so if you want to expand on it any in your answer, you can. Why are careers in behavioral health, and that could be social work, counseling, psychology, psychiatry, nurse practitioner work, it could be peer recovery support. Why are these careers so crucial for our state and our communities?
Hi, it's Olivia again. I kind of, building off of what Alice was saying, it's crucial because there's such a lack, especially in the more rural parts of West Virginia. Working with substance use disorder and thought disorders. Myself, seeing how far people drive to get quality care, in my opinion, is just not okay. And it shouldn't take 4 hours to get to an appointment for quality care. And, then building off of, again, what Alice was saying, just the lack of connection and understanding, that kind of goes into the quality care. There's so it's so difficult to connect with different populations. And, you know, if you have a passion for a specific population, use that to connect with them and give them that quality care that they can't get. Even with the increase in tele with COVID, you know, that's opened up a lot of doors as far as access goes, but it's still very sparse, and resources are so limited with people in more rural areas. And so it's really can be difficult.
Thanks, Olivia. That's great thoughts.
I was gonna say, I can touch on this again real quick if you don't mind. West Virginia is just in dire need of resources to help turn the tides between the opioid crisis, poverty, the rising homeless population, the hard hit that we all took with COVID-19, and the dance of trying to learn how to adapt along the way. If anything, trying to work as I'm currently in my internship and getting ready to graduate, but just seeing the way that COVID really highlighted a lot of the gaps in, where we thought we were prepared for something, we really weren't. And like Olivia was saying, telehealth has kind of made a positive difference for some of it, but telehealth's not appropriate for everyone. With West Virginia being mostly rural, you have multiple different challenges, such as being homeless. How do you get them access to the telehealth? People don't have stable internet connections. If someone's actively psychotic, they're not appropriate for telehealth. With someone who's, for example, I'm located here in Morgantown. If someone's down in, say, Boone County, that's not an appropriate healthcare option for them. And so being able to kind of try to find a way to reach these populations as well has been very challenging. In my internship, I'm currently working at Mountaineer Psychological Services, and I do a lot of psych evals as well, specifically for ADHD, like diagnostic clarification. One of the challenges with telehealth is that if you cannot establish who that person is, I can't see that person. If I can't even at least see their face and be able to, see that is this person who they say that they are, I can't do that evaluation. And so, that's just another challenge when we didn't need more challenges to begin with, and getting people the help that they need. And so if we really need these behavioral health careers, because if you need specialized care, if you need a full cardiac evaluation, you're not going to go to your podiatrist. I think that primary care providers have done the best that they can with, trying to help with prescribing medication, but we need people who specialize in mental health care to work with mental health disorders and illnesses. That's our role to play, and West Virginia is crying out for help, and it's our job to do the best that we can to provide that quality care.
Yeah, such great points that you bring up, Ellis. Thank you for talking about that. Sheba, did you want to respond to that question as well?
Yes, please. Yeah, I was gonna say I know that there's, a lot of memes out there and a little bit more talk about medications for behavioral health disorders or conditions. Sorry, I don't know why I said disorders. There is like a little bit less stigma, I think, around talking about it or maybe joking about it, but there is still a lot of stigma, I feel like, overall in general in the public, maybe about therapy, about taking medications for even something as simple as depression. So I can't even imagine like having, an antipsychotic medication to take or something, and so those are still very stigmatized, and that doesn't help with treatment at all. We see that with, different kinds of treatment for addiction, and some pathways are considered to be more legitimate, I think, like 12-step recovery programs, which I'm not saying anything bad about them, but they're very traditional and they don't necessarily include everyone's struggle. I don't think they're fully inclusive. I feel like you can actually just see that with the language that they use. I think it's very Eurocentric, very centered on the white experience is what I have felt like. And it's very important to point those things out, I think, and talk about them and acknowledge that they exist, because, you know, racism is a real thing and it does exist, and it does exist in our state. And we can't tackle those social determinants unless we talk about it, unless we actually do something about it. And the way that that plays a role into this is that, you know, when we think about like nature and nurture, I think a lot of us know by now that it isn't nature versus nurture, it's both that affect anybody, you know, with anything in their life. And so to be able to build somebody up, you would need to know and have an understanding and kind of truly appreciate like someone's experience, and things like racism, sexism, you know, homophobia, any phobia, transphobia, you know, all of those things are deficits of our society and of our state. And I feel like those also don't help in this feeling of behavioral health conditions being like seen as a death sentence, seeing people as only their quote unquote disorder, right? And not more. They're not seen as real people. And so I think to be able to fully work with someone and be able to build them up through the gifts that they have in their life and in their journey and in their unique backgrounds, I think those things need to be considered. Sorry if that was sort of everything in a whirlwind.
Great. That's great. You really led us into the next question. You know, as Cynthia mentioned in her introduction, many populations in West Virginia experience behavioral health care disparities. And the panelists have already started kind of sharing a little bit about that. So for this next response, can you all discuss the importance of behavioral health professionals in promoting social justice and or reducing behavioral health care disparities in underserved populations in our state?
I can go ahead and speak again about this for a minute. So, you know, Sheba did a great job of kind of leading us into this and already touched on a few different things as far as the various, you know, isms that are present. And I think all healthcare as a whole, whether it's, you know, your stereotypical medical care or mental health care, behavioral health, across the board. And I think that it's very difficult to provide quality care when, you know, people don't even fully understand what, you know, behavioral health is to begin with, and the stigma that's met with that. When you start adding in, you know, diverse populations that people understand even less about, it gets even more dicey. You know, again, speaking as a transgender man, I've had my own experiences where, you know, just people don't fully understand what they're talking about. You know, some of the language is very outdated. It's very difficult to kind of stay on top of things. And, you know, even as somebody in the community, it's constantly changing. We have to adapt. We can't draw the line in the sand. It's our job to grow as professionals with the people that we're seeing, and adapt as we go. And, you know, even trying to find, like I said, quality healthcare or even, you know, gender affirming care is so incredibly difficult in the state of West Virginia. And for myself, you know, going to Pennsylvania shaved off months or even years of trying to, you know, acquire that care. And so being able to have access to this medically necessary treatment, it's very important because, you know, behavioral health care it can be a death sentence for people. And, you know, there's a timeline. People can't wait forever to get the treatment that they need.
Thank you, Ellis. Thank you for responding to that. Is there anything either of the other two of you would like to add for that question? All right, well, I'm going to go ahead and pose our final question to the panelists. The time has gone by very quickly with our panel today. This question is really about the next generation to which you're leading the way of our behavioral health professionals. What words of encouragement can each of you share for students in their educational or career journey?
I can go ahead and start with this one. One of the biggest things that I think is important to know is, you know, don't be afraid to let your experiences, good or bad, help you through what you're doing. You know, that was one of the reasons that I never wanted to do anything with behavioral health. You know, I grew up with substance use disorder throughout my family, and I wanted to stay away from it. And, you know, once I got past that mental block that I had there, I found out that that's where I'm supposed to be, because I can connect with clients and help them more so than someone who doesn't have any experience at all. And there's a different kind of understanding. So just don't be afraid to use that, and also don't be afraid to seek out help for yourself. You know, there's never anything wrong with working through things that are going on with you, whether it's stress with what you're doing or trying to work through your own things to be able to help others. It's only going to make you a better provider in the long run.
That's great, Olivia. Really good advice and encouragement for people considering this field. Sheba?
Sorry, I was trying to unmute myself. Thank you. Yeah, I too agree with Olivia. That was one of my points that I wanted to say, so I won't reiterate it. But I think another thing to consider with doing the inner work, I feel like the reason that I'm able to show up today fully and, you know, be able to talk about even something as uncomfortable as racism I mean, I can't see everyone's faces, but I feel like the room is quite full of white people, mostly. And usually that would make me feel uncomfortable and not want to talk about, you know, things like racism or pointing out disparities. And, you know, I am a little bit nervous, but I'm not scared today to say stuff because I truly believe that it's important to, you know, talk about it. And the only way that I got here is because I did, you know, start therapy when I was in college and really enjoyed the process. I love therapy. And I feel like I will become, if I become a therapist in the future, then I will be that therapist that has a therapist. Like, I think that's awesome. I think that should be honestly like promoted to kind of like, if you're going to be a mentor, why wouldn't you want to have a mentor yourself, you know, to like keep growing. So that's why I think that's important. And also to, I think to just address your own biases, you know, we all have them. We all have internalized racism, sexism, all those things we have. We can't deny that we have them. We grew up in this culture and it's very rampant. So don't deny that you like don't have it, because you do. It's just figuring out what, you know, why did that come about? Who taught you those things? Was it the culture? Was it your parents? Was it, you know, who you were around, your peers, you know, things like that. It's good to go through those things so that you don't affect your clients in a bad way. and understanding your own behaviors, understanding, why you do the things that you do, and also like truly like appreciating yourself and doing self-care, not the stereotypical self-care that people talk about, but true self-care. So truly taking care of you and and other people. And sorry, I don't mean to ramble on. I just wanted to say that it's really important to do that inner work, so that you can be there for your clients and also your coworkers and everyone else in your life. So thank you.
That's great. That's really good advice and some good insights for everyone that are people who are considering this career path to think about, just when it comes to their own mental health. And in any way, seeking out treatment can only help make you a better provider. Ellis, would you like to close us out with your encouragement for students?
I'd love to, thank you. So, Olivia and Sheba both touched very well on self-care and, the importance of that inner work and, growing through our professionalism. You never stop learning, or at least you shouldn't. Things change vastly over the years, even over months. So there's always more to learn and more work to be done. My advice to all of you as students is don't be afraid to try different things. While here in school is the perfect time to gain different experiences and to work with various populations. And sometimes what you might think that you really want to work with might not be where you end up. When I decided I wanted to go into psychology, I thought I'd be working with kids. No, kids aren't for me. So I've started the journey planning to work with children, and I have found my stride working with adults and adolescents. I never planned to enjoy working with substance use populations or people with traumatic backgrounds. I always found that it would probably be, a little bit daunting for me. I never really felt comfortable doing it, but I've found the work to be incredibly rewarding, and, just experience as much as you can while you can, and don't be afraid to try different things.
Thank you all so much. Would everyone out there in the audience please just join me in thanking Sheba, Ellis, and Olivia for being with us today. Olivia sent a message. She had to hop off the call to meet with a client, but we appreciate the three of you so much being here, taking time out of your busy lives, jobs, internships, school, to speak to students today. And we wish each of you just the very best as you continue your careers in behavioral health. We can't wait to see what you accomplish, and hopefully you'll be coming back to a conference like this as panelists with several years of experience under your belts in the future. So thank you again, and make sure you check out the chat before you get off the call today. There are lots of things, lots of encouragement for you all as professionals there. So we're going to keep moving right forward with our final section of this session. As you all know, my name is Carolyn, and I am with the Behavioral Health Programs at the Higher Education Policy Commission. In my current role at HEPC, I practice what is referred to as macro social work. And so macro social work is focused on building policy and programming to address system level changes. So in macro social work, communities or states or systems are your clients rather than individuals or families that are typically served by clinical social workers. Like the many panelists that you're going to hear from today and those that you have heard from, I really wasn't aware of all the career possibilities when I started my college education. As a kid, I didn't know what I wanted to be when I grew up. But when I was in middle school, I had the opportunity to be trained as a peer counselor. And then I was active in community service projects and service organizations throughout high school. And so I didn't realize it at the time, but those experiences were really laying a groundwork for a career in social work for me. I took a college psychology class while I was still in high school, and that got me interested in pursuing psychology as my undergraduate major. And then when I was a senior in college, I took a social work policy course as an elective. And I loved it so much that I decided to pursue a Master of Social Work degree. So then after I finished my bachelor's, I spent a year in AmeriCorps working with a community rural health program that was connected to a medical school in a rural community. And looking back, that year of AmeriCorps was very career shaping for me, and it was a great way to earn some hands-on experience before I got out into the workforce fully. After that, I obtained my MSW from a program as with an administrative or macro social work focus. And from there, I worked in research, school social work, and for a nonprofit health organization. So now, a couple of decades in, I have found social work to really be a rewarding career that allows me to keep learning and growing and making connections. Even though I practice a different type of social work than many of the clinical therapists that you'll hear from during our panels, it's still social work and it's still a wonderful career path. But enough about my educational pathway. We're really happy to have each and every one of you attending this event. We have over 300 people registered for this event and more than 30 speakers and panelists joining us. You'll notice that people are coming and going from different sessions. Some are attending with a class, and so you may see only one person or one Zoom box, but they may be attending with 20 or 30 people in their classroom. Also, we have quite a few people who are planning to check out the audio and video recordings of the event. And so you are joined by a great potential workforce or future workforce of behavioral health professionals for this conference. So I want to take just the next couple of minutes to highlight some of the online resources that go along with our conference today and also tomorrow. So I'm going to share my screen. All right. Okay, so first of all, the Behavioral Health Workforce WV.com website, which I'm going to pull up for you here shortly, is kind of home base for this conference. So if you get to this website and click on the News and Events tab, you'll see there's our conference logo. Here you can access the agenda to see all the details about speakers from the conference. If you scroll down, you'll see some of the handouts and presentation slides from today and tomorrow. You can click here for the evaluation at the end of the conference. If you're a graduate student or an undergraduate student looking for graduate school, here's some GRE preparation materials. You can also get a link here to go over to our next tab, which is the Education and Careers page. On this page, you can get access to our Behavioral Health Pathways Guide, which I'll show you here. This pathway guide is a booklet that's designed for students in high school, undergraduate, or graduate level who are thinking about a career in behavioral health. As you flip through the pages, you can see what your options are in social work, counseling, or psychology, what type of license you would need to practice in each of those fields. You can also get tips for what you might be able to do to prepare yourself while you're in high school or while you're making decisions about college to pursue these career paths. Going back over to our Education and Careers page, if you scroll down, you can get access to the Career Pathways video series. Here in the gray box, you can see the different types of topics that are covered by the videos. If you click on the link, it'll take you over to our YouTube page where you can see all the different videos. Students, just like the students who have spoken for us earlier today, have videos where they're sharing about their career pathway, advice that they give to other students, professionals sharing about their pathways. We also have videos from training programs. So if you're in a bachelor's program and you're looking for a master's program, you can look at the different programs in social work across the state, different programs in psychology across the state. Lots of good information here, short videos for you to check out. If you go back over to the Education and Careers page, at the bottom, you can find lots of links for scholarship and loan repayment information. So if you want to check out financial aid, scholarship search, or looking at the loan repayment programs that we'll be learning more about tomorrow. Then at the bottom here, we have career exploration tools. There are several links that you can click on and explore if you want to compare what salary will I make as a social worker versus a counselor, or what are my options if I get a master's degree in psychology versus a doctorate degree. You can learn all of those different things here. I want to bring your attention specifically to this tab, which says Explore Programs and Majors in the Human Services and Health Sciences Career Clusters on College for WV. CFWV.com or College for West Virginia is a great resource for anybody if they're thinking about going to college. It can help you plan out your education. You can learn about financial aid. On this site, there is just a wealth of information on CFWV.com. You're going to be hearing a little bit more about financial aid during the sessions tomorrow. You can go down through here and click on any of these programs to learn more. But if you're concerned about how are you going to pay to become a social worker, how are you going to pay to become a psychologist, how are you going to pay back student loans, then this site is definitely for you. All right, so we're going to go back over here to the page where we were. Also, if you have more interest in behavioral health, you can check out the other tabs beyond the education and careers and conference page. You can look at our data so you can find out more about workforce supply and demand within the state of West Virginia for behavioral health. All right, so with that, we're going to take a few minutes to have a brief break. And for the sake of time, this is going to be our only scheduled break during the conference, but we invite you to step away and take care of yourself and come back as you need to throughout the event. The conference is being recorded. Our next session will be the Education and Career Panel, working with children, youth, and families. And we will have a moderator and 4 panelists joining us. So take a quick break. We'll be back in about 5 minutes. All right, welcome back, everybody. Hope you had the time to go get a drink of water or stand up and stretch. We are going to get going with our first panel of career professionals. This is the Education and Career Panel, working with children, youth, and families. And I would like to introduce our moderator, Carrie Rischel. Dr. Rischel is a professor and the director of the Rural Integrated Behavioral Health Training Program at WVU's School of Social Work. Carrie, are you there?
Yep, I'm here. Nice to see you.
All right, I will go ahead and turn it over to Carrie, who is going to introduce our panelists and get started with questions. Now, during this panel, some of the questions have been submitted by students in advance, but we also encourage anybody on the call today to go ahead and chat in any questions that you have for the professionals. All right, over to you, Carrie.
All right, thanks. Welcome, everybody. It's nice to see you, and we will get started with the panel. So we have 4 panelists today, and I will just introduce them briefly one by one and ask them to just give a 2 to 3 minute sort of introduction on what they do, and then we will get started with the questions. So our first panelist is Shelly Plosh. Did I pronounce that correctly? I'm not sure.
Plosh.
Plosh, thank you. Shelly Plosh. And Shelly is a licensed social worker and director of training, education, and staff development at the Children's Home Society of West Virginia. So Shelly, I'll just let you go ahead and do a 2 to 3 minute introduction of what you do.
Okay, and just for clarification, Carrie, do you want to know like what my current job is or kind of what my career pathway has been?
I think both, sort of what your current job is, and then sort of how you see yourself having gotten there, your major and jobs that contributed to where you are now.
Okay. Well, thank you. And thank you for having me. It's really a pleasure to be a part of your conference and being here with all of you today. And just a little bit about how I did get to where I am is that, I didn't always know that I wanted to be in social work. I did ultimately graduate with a bachelor's degree in social work, but I didn't start there. I started as an interior design major, and I recognized 2 years into that degree that wasn't a good fit for me. And so I had some time of self-reflection and recognized that, I always had a passion for helping others and wanting to strengthen my community. And so I switched to social work at that time. Also, originally, I thought that I was interested in working with in the adult mental health sector. And through my field placements, I quickly learned that also wasn't a good fit, and then was able to work with children and families in a couple of different settings through field placement, and realized that is really what I enjoyed doing, and that was that was meant for me. And after I graduated, I did work in residential treatment facility for adolescents. I also worked in a residential wilderness camp for at-risk youth. I enjoyed both of those very much. I ultimately then became a social worker at a youth emergency shelter. And then I ended up supervising that shelter for many years. And during that time, I decided to get my master's degree in social work as a way to kind of further my education and my career opportunities. And once I graduated with my master's degree, I was able to oversee a multitude of child serving programs over a multi-county region. Again, great experiences. And then ultimately led me to where I am today, again, being the director of training, education, and staff development for my organization. And with that, I'm really able to use my past experiences and, all that I've gained and learned to help others on their path. And it's a relatively new position for me. I am enjoying it as it is developing. And, I just feel, I've just enjoyed every phase of my career and the challenges and the rewards that it has brought to me. And I really love being part of a helping profession and feeling like that I'm doing something meaningful and giving back. So that's kind of about me.
Great. Thank you so much, Shelly.
Sure.
So our next panelist is Christina Schreiber. Christina, are you here? I can't see you on my
I'm
screen.
here.
Okay, so and did I pronounce your name correctly?
You did.
Wonderful. So Christina is a licensed professional counselor and works as a school counselor in the Cabell County schools. So Christina, could you go ahead and sort of introduce yourself and your job role, but then also a little bit of your progression about how you got there?
Sure. All right. Like she said, my name is Christina, and I am an elementary school counselor right now. This is not always where I've been, though. I've started out, I feel like I've worked a little bit of everywhere in the behavioral health field, working with children and families. I got my bachelor's degree in psychology, and then later on my master's in counseling. So I started out actually at the Department of Health and Human Services as a CPS worker. So I started out in social work. Then while I was doing that, I went back and got my master's degree in counseling. So I've worked with I've worked for some private agencies. I've also done a little bit of clinical counseling. I've been a school counselor for 12 years. This is my 12th year with Cabell County schools. I've worked at all levels. I've worked in high school, middle, and elementary. And so I think this array of different positions I've had throughout the last 21 years has given me kind of a broad outlook on the behavioral health field. And I landed here in elementary school, which is my absolute perfect fit, and I love it here. And but that doesn't mean I didn't like my other positions either. I did like parts of them, all of them, all the way back to Child Protective Services, even though that was very challenging. I have a counseling license and a social work license from my days working for the department. And I guess that's about it in a nutshell. I've kind of been a little bit of everywhere, but I think I'm here in the school system to stay.
Great. Thank you, Christina. I'm looking
Thanks.
forward to hearing more about your experience. So our next panelist is Jessica Cole. And Jessica is a licensed independent clinical social worker and works as a therapist for a continuous journey. So Jessica, could you do a little introduction of yourself and sort of how you got to where you are?
Yeah, absolutely. Hi, I'm Jess. I currently am a therapist in a private practice. My journey started out at Shepherd University, where I did my BSW as well as a BS in economics with a minor in sociology. I'm originally from what I call real West Virginia, but after coming to Shepherd and falling in love with the Eastern Panhandle, I settled here. And I decided to take advantage of all the educational opportunities I could get while having the Promise Scholarship. So that's why I did a dual degree program with my bachelor's degree in 4 years, because there's no limit on how many degrees you can get. It's just the 4-year limit. So I tried to work that system. After that, I stayed in the Eastern Panhandle, worked for a year doing some community outreach, and also dabbled with working in medication assisted treatment. And felt like that really wasn't quite a good fit for me. Decided to go on and get my master's in social work. Moved to Texas for a year and did my master's at Baylor University with a concentration in children and families. And while there, my field placement was a residential facility in Waco, Texas. So that's when I caught the residential bug. And when I returned to West Virginia, I too joined Children's Home Society. And was a shelter supervisor for their Martinsburg shelter for several years, and then transitioned into a role of therapist, eventually mid-level management, and then ultimately director of residential treatment, adolescent residential treatment facility with another agency in the Panhandle. I stepped into the role of director of residential treatment right before the pandemic struck. And so trying to navigate and survive congregate care in a pandemic was fun, to say the least. And so after about 1.5 years of that, and having done residential for almost a decade, I felt for myself and my family, it was best for me to take a bit of a step back. And I decided I had already obtained my independent license through supervision with the agency I was with. I always carried a caseload and worked as a therapist, even as a director. And so I stepped into private practice, and I'm currently contracted with this private practice. And I'm also pursuing my doctorate in social work through Tulane University. So that's kind of how I've gotten here.
Thank you, Jess. That's great. So many different experiences that you have to share. So that's really great. And then our final panelist is Sandra Strobel. Are you on the call? Dr.
Yes, I am. Thank you.
Okay, so Dr. Strobel is a psychologist and a school psychologist and faculty at Marshall University. So I'll let her go ahead and do her introduction.
Thank you so much for allowing me to be here today and talk about psychology and school psychology. My journey will echo the others, and I think it's important for everybody to hear that as opportunities come your way, you need to grab them, and there's lots of different avenues that you can take. And I think that's what makes this field exciting. And so from a young age, I had decided I wanted to help others. So an undergraduate, I majored in psychology, and then finishing psychology at a bachelor's level, I realized I needed to go to graduate school. I decided I wanted to work with children, but when I was trying to get into some child clinical programs, I knew it was really competitive, started exploring some other options, saw that school psychology, something that I'd never heard of, was an option, applied, got a full scholarship at the University of South Carolina in school psychology. So that attracted me, went there. Another exciting thing about school psychology is once you graduate or go out in your internship, you can go anywhere in the United States. And so I was married at that time, and my husband said, let's try Florida. So we went to Florida. I did my internship there. I worked a year. Then he wanted to pursue graduate work. And so we went back to South Carolina, worked there. And then his job took us to West Virginia, where I decided then to do some private work. And I worked at a place called Learning Enhancement Center with a clinical child psychologist. While he was supervising me, he said, hey, think about getting licensed, because in my field, you get licensed as a school psychologist with the West Virginia Department of Education, but you can also get licensed by the West Virginia Board of Examiners. And I went through that process and became licensed as a psychologist and a school psychologist, worked for a while in psychiatrist offices. And then one day when I was doing some continuing ed, one of the professors was doing a presentation and said, we need faculty. And so found out that there was a school psychology program right where I was living in South Charleston. So applied to that and has been a professor since 2005 and since 2010 been an associate dean. So my journey, like the others, is varied, but I think that makes it exciting that you can do lots of different things.
Definitely. Thank you so much. So we will move forward and start with the questions. And I know that we have prepared questions from students, and then we also encourage you to type the questions into the chat. There's the chat. I had just lost the chat for a minute. Type your questions into the chat, and then we can take questions directly from this group. So I'm going to start with the one that is here in the chat, who asks, do we get field experience throughout our education? So I'm wondering if each of the panelists could just talk about their discipline or their profession and what the standard is for field education as part of your training. Is there anybody that wants to start with that?
I can talk about that
Okay.
as a faculty member. So in school psychology, and often people don't even know what a school psychologist is, but we are not school counselors. Christina's here today representing that. But as a school psychologist, from the first semester you're enrolled in our program here at Marshall, we have you out doing things. We have you shadowing, other professionals. We have you out there doing lots of observations. So we want you out there. And the nice thing about that is that once you are out there from that first semester, you can decide, yeah, this is for me, or no, it's not, or maybe see something else that you're more interested in. Of course, as you progress through the program, you have more experiences and more requirements of things that you need to do, first alongside a professional and then independently. So the answer for school psychology, and I believe psychology, is yes.
Great, thank you.
With social work at the bachelor's and master's level, there are field practice components of varying depending upon state regulations and expectations, 500 to 600 hours to meet the CSWE standards. The doctorate in social work program that I'm currently in doesn't have field experience. It's more of a project-based and program evaluation type program. So at that level, there's not necessarily direct field experience, but everyone has to actively be practicing in social work. So you're already kind of in the field. But yes, at master's and bachelor's level, lots of field work, lots of experience that's hands-on, and you get a voice in those experiences as well, whether it's through interviewing, kind of picking your top 3 placement populations ideas. So you can kind of, I think like Shelly touched on, be like, oh, maybe this isn't for me, or, oh yes, this is absolutely what I want to do for the rest of my life.
Thank you. Shelly, do you want to add anything to that from the social work perspective?
No, I really echo what Jess said. And what I would just add is that the field placements are so important because, like Jess said, and I touched on earlier, it really does give you that opportunity to explore, many different, areas. Like panelists talked about earlier, there's so many different things that you can do in social work. There's so many avenues to explore. So you get that opportunity to really get in there and be a part of many different settings, and helps you to really choose what you feel like a good fit is for you, because it's hard to know, early on in your education. So just having that real practical experience is so helpful and really good to, make the most of it and take the opportunity to, soak it all up and figure out what's a good fit for you.
Yes, definitely. And I'll echo that too, as social work faculty, that I always encourage my students that in their placements, they may learn about populations or settings that they really enjoy working with, or they may learn about settings of populations that they really don't enjoy working with. And both of those things are great things to learn. So yes, taking advantage of those is really good. So Christina, from the counseling perspective, what can you talk a little bit about the field experience for that profession?
Sure. So specifically in school counseling, we have students that come and work with us that will be working on their practicum, which is not as long as an internship, but similar. It's kind of getting a feel for what the job is all about. And then we also have internships where the students come and work alongside us. And for either of those, the students get to do, pretty much everything that we get to do. They get to talk with the students, meet with the students, practice some of their skills, and even, like as a school counselor, we teach guidance lessons too. And, I always let them do that. I'm happy to let them get some practice doing that, because I think it helps them get a feel. I had a practicum student about a year ago that was working with me and did some guidance lessons, and she was great. And by the time she was done, she decided she liked the high school level the best. And so I think that was really good that she got that, got that experience, because, I feel like elementary fits me the best, but other people will like, the higher levels or the lower levels. So that's a good experience. As far as classes go, counseling classes in general, there are some opportunities to get out and kind of at least observe what goes on in the field. I know during an addictions class, I got to go to several AA meetings, NA meetings. And so different classes will have opportunities to get out in the field and kind of see what's done in the counseling field.
Great, thank you, all of our panelists, for that, and sort of laying out the types of field experiences that are available in the different disciplines and professions. So I'm going to go to our list of prepared questions from students, but again, please, if you have a question, type it into the chat, or if you just have a comment, type that into the chat as well. So panelists, what is one thing you'd tell your student self with the experience you have now? So looking back onto yourself when you were a student, what's one thing you wish you knew then that you know now that might have I don't know, helped you better prepare as you moved through your training and career?
I definitely have one for this. I got my bachelor's degree in psychology, as I said, because I've always been interested in, behavioral health, like I said. But I feel like I did not have, and this was nobody's fault, I didn't have a lot of guidance as to where to go with a bachelor's degree in psychology. So maybe knowing that as a student, I may have started originally in counseling, knowing that this is more of where, I wanted to be. So my advice would be ask questions about, what you can do with your degree, if any chance to get real world experience to make sure that that's what you want, take it.
Great advice. Jess, do you have something to add to that?
Yeah, I would say foster relationships, especially with faculty members. That was something that, trying to do a dual degree, breaking out in hives, all that fun stuff, and stress at a bachelor's level. Those relationships that I had with faculty members are really what kept me going, and the same at the graduate school level. Working as a grad assistant, that particular professor really spoke into my life, and we still have intermittent, connections and conversations and check in with one another, because it can really have a positive impact, but it also helps you see things in a little bit of a different light. So relationships are really important throughout this process. No man is an island, no woman is an island. So reach out and talk to people.
Yeah, that's definitely great advice. And I'll just echo that on the faculty's perspective, that I really like it when students want to talk more and build those relationships. And I have students and graduates that I'm still in contact with years later. So that's a great networking skill too. Either of our other panelists, can you think of something you wish your student self would have known? Shelly?
I guess I would just say, keep your humility. We as humans, we are not perfect. Almost, everybody will forgive an honest mistake, as long as we're, you're upfront and you're honest about that. And politeness and humility and empathy, just it goes, a long way, as you kind of exit school and start your career. And just never stop learning and growing and developing your skills. It doesn't stop with your formal education. There's always something more to learn. And that's one of the wonderful things I also think about the profession is there's so many opportunities for wonderful classes and what you learn from coworkers and teammates and people and other organizations. And so there's always so much to learn, and you can always continually develop your skills, which keeps the work engaging and challenging and fun.
Yes,
I think I would say to keep that work personal time balance, to make sure you pay attention to wellness. I think we talk about that a lot more now with COVID, but I think as a student, sometimes I spent a lot of hours studying and kind of cut myself off from my experiences. So I think you can have work-life balance and have both, to just remember to have some fun while you're studying for that degree. It doesn't mean you have to put everything on hold.
Great advice. So moving on maybe just to something more concrete, students are interested in whether a license is required for the work that you do. So I wondered if each of you could just talk a little bit about sort of the licensing process in your field, and if you need a license for what you're doing or not.
I can go ahead. For social work, depending upon the position that you're in, a license is required. At my level, practicing as an independent therapist, I do have to have a license in order to do so through the West Virginia Social Work Board. And so through that process, when I had my bachelor, for example, when I had my bachelor's in social work, I did not obtain my LSW license because the roles that I was in, or I was working in different states and things of that nature, it wasn't required. And then with my master's, I've had my LGSW There's also an LCSW, which is 2 years postgraduate, and there's a licensing exam you can take with that, as well as eventually the LI, which is 2 years, at the minimum of 2 years of supervision with 100 face-to-face or split up between face-to-face and virtual hours of direct supervision with an LICSW. And so that process is sometimes a little bit complex, but other roles that I've been in, such as a residential therapist, because they primarily have Medicaid, they don't necessarily require a license as a therapist. So sometimes it's agency based. So like the agency I was within 6 months of employment did require a minimum of that LGSW. So sometimes it can be agency based, but depending on the position, it is required.
Anything, Shelley, you want to add to that? So we'll stick with social work for a minute and then move to the other disciplines.
Just covered that very well. And in some of the roles I've had prior, I was required to have a license, particularly as working as a social worker, and my scope of practice, in that regard. My current position does not require me to have a social work license, but I choose to keep my license active. And so, and to do that, it's 40 hours of continuing education every 2 years. And I do choose to keep my social work license active, even though I don't currently need to have one for my scope of practice.
Yes, thank you. And I'll echo that also as a licensed social worker who's a faculty member. I also choose to keep my license active, even though I don't necessarily need it. And that's advice my mom gave me way back as a licensed psychologist, is once I have my license, don't ever let it go. Because it's easier to keep it than it is to reinstate. So Christina, do you want to talk a little bit about the licensing process in counseling?
Sure. So for school counselor, a license is not required, at least not in West Virginia. However, I choose to keep mine because I think it's a good opportunity. We keep learning. We have to have 30 hours every 2 years, and that includes ethics and veterans. And I think that's really important in our field to keep learning. It also opens up other opportunities. I've worked at other jobs while I've been in the school system, such as I did some counseling for NECO, and I was required to have a license there. So luckily I did. I kept my social work license from when I worked at CPS because, again, I believe that, it opens up a lot of opportunities. Even though I don't need a social work license for this job, I have used my social work license over the years. The reason I was able to get one is because I was grandfathered in. I had a behavioral health degree, and so I was supervised for 2 years and was able to get my temporary license and then my social work license. I have an LSW, which is different from our other panelist here. As far as my counseling license goes, the process is pretty much the same. You're supervised for 2 years. You meet with your supervisor. You kind of learn about ethics and different issues through them. They help you along the way. And once you've met all the requirements, then you're able to get your license. And then, just keep up the continuing education to keep that every 2 years. So personally, I recommend it. You don't have to have it for some agencies, and definitely not for the school system, but I personally would do it.
Great, thank you. Dr. Strobel, do you want to cover the psychology for us?
Sure. So I'm going to talk about psychology and school psychology. So for school psychology, in addition to graduating from our program, you have to pass a praxis exam, and then you can get licensed through the West Virginia Department of Education to practice as a school psychologist in schools. You also have the opportunity to work independently, not employed by the schools. And to do that, you have to go through the West Virginia Board of Examiners of Psychologists, and you have to be supervised. There's 2 levels. There's a level 1 where you can do contract work for testing in schools. And then level 2, you can work independently outside of schools or contract with schools. So to get the level 1, you need 2 years of supervised experience, where the Board of Examiners issues you a gold card that you work while you're being supervised. And then you need an additional 2 years to get the level 2. So that's what's needed for school psychologists. Psychologists, I think they can work for some organizations, like we've said here, for social workers and not be licensed, but to work in private practice and independently, they would also have to go through the West Virginia Board of Examiners. And if you had a doctoral degree, you would be able to count your internship and get licensed by also, you have to pass an exam. It's called the Examination for Professional Practice in Psychology. It's called the EPPP. Then you have to have orals in front of the board. And then if you're a master's level, you have to also do the orals in front of the board, pass the EPPP, and you have to be supervised for 5 years while having your gold card. I currently am an associate dean, so I don't need to be licensed in that role, but I provide service in the community. I do counseling through my church, and I do psychoeducational evaluations in the community. And to do both of those things, I need to be licensed. So I keep my license current also with continuing education.
Great, thank you. So there's somewhat similar processes across the different fields and professions, but each have their own, board, licensing board and particular rules. So again, just a reminder, if anyone has a question from this group, please type it in the chat. We would love to hear the questions from you. I'm going to go on to another one and focus more on the benefits or the good parts about working with children and families. So panelists, what would you say are some of your, your favorite parts about the work that you do? What gets you up in the morning and keeps you going in this type of work? Anybody want to start with that?
Go ahead. I was just going to say, I really like the opportunities in my role for early intervention and working with children that we can intervene early to help them. I see, especially with COVID right now, a lot of children suffering with anxiety. They're worried about being sick and all these things. And it's so nice to try to work with children and families to build coping skills that I know that they can carry with them the rest of their lives. And then sometimes you don't even think you're making such an impact. And then you'll get a report about how they use their skills at home or in school, or they'll, tell their mom or dad they want to come back and see you. And you just have that good feeling that you're making a difference, and the kids are enjoying the therapy that you're doing with them.
Great, thank you. Jess, want to go ahead?
Sure. I think it's been interesting kind of transitioning out of residential, which is typically kind of an all hands on deck, oh no, things are combusting type situation, to being more community-based and doing outpatient therapy. And I've really enjoyed that transition of trying to be more proactive and trying to, be more preventative in our responses. I had a lot of positive experiences within residential and intervening with children, but typically within residential, especially in a state like West Virginia, it's based upon what bed is available. So that bed could be 5 hours away from the family. And it's get them there now, or they're sleeping potentially in a DHHR office, whether at the residential level or the shelter level. And so, it's not always the most conducive to family engagement and interventions, and it makes it significantly more challenging. I think COVID has actually, that's been a positive of COVID, is that there has been an emphasis on we have to establish more virtual resources and connection for families, because there wasn't the ability to do face-to-face home visits, things like that. So that was one of the benefits I actually found with COVID while doing residential, is now, all right, we do finally have Zoom capabilities, or we are doing more teletherapy and family therapy via virtual means. And so I think that's been a positive. But having, kids that have done $1,500 worth of destruction to my personal vehicle, and then 2 years later calling in and saying, you changed my life, thank you so much, and sorry about your car, those are the moments that you're like, all right, I can hold on to that for a couple months, thanks. I appreciate that. And that's especially working with teenagers. I love working with teenagers. And so those are some of the benefits and the hopes that I see with that.
Great, thank you. Shelly, want to go ahead?
Sure. In working with families over time, so many times it's a family just fallen on a hard situation, and they're working hard, they're really trying, and they just need a little bit of a hand up, and so sometimes just giving the smallest concrete support or help can make such a big difference in somebody's life. And and in those situations, people can be so appreciative and really let you know, what a difference that makes. And it really does kind of fill your cup, or, keep that cup full. And like Dr. Strobel was saying earlier too, that opportunity to make a difference. And you might not always know the impact that you're making right away, particularly working in, youth emergency shelter settings or foster care settings and things. You don't always see it directly. And then somebody years later will come up to you in the community and tell you what a difference that you have made in their life, and how they've held on to something that you did for them, which at the time you might have just thought was a common courtesy, or treating somebody well. And just that little bit was enough to make a difference and carry them through. And that's that really does keep you going, and it's very special. So that's it.
Yeah, I agree with that. From my time working with children and families too, it's just those small moments can make a big difference. Christina, do you have something you want to share with us too?
I think I would just echo what everyone else said. Sometimes you don't know what a difference you're making until later, but it can be very rewarding. I love working with children. I feel like it's my place. And, sometimes here in the school system, we might be their only connection. We don't know what their home lives are like a lot of the times, and they don't have anyone to reach out to. But if we make ourselves available, sometimes that will give a kid somebody to talk to that they didn't have before, that extra person in their life. And I think that's really important, especially with everything going on in the world, that they're confused, and it's been scary. And so, I think what we do is important. And someone said something about preventative stuff, I think is important at this age. Just with like I said, so much going on in the world, and we don't know what's going on at home sometimes. And so, I think all of that's getting to them early is important too. So yeah, that's one of the things that keeps me going.
Great, thank you. It's so good to hear, I think, from a student perspective, what it is that you really love about your job, and the stuff that keeps motivating you to move forward. So another question that was sent in by a student, and one that my students ask me a lot also, is about work-life balance. So what measures do you take to ensure that your work life and the stress involved doesn't carry over too much into your own personal life? And working with children and families, sometimes it's a lot. So what are some things that you guys do to self-care, take care of yourself and maintain that balance?
I think that was part of coming to a realization that I wasn't doing that well, was part of what kind of spurred my transition in a career. And it's something that I really appreciate about social work, is there is that flexibility of, there are so many roles that you can work within, from medical to VA to children and families to private practice to teaching, whatever it might be. And so for me, it was really a come to Jesus moment of, I'm not balancing that well. It was hard doing congregate care and being in a director role, especially when I'm the kind of person who is very hands-on. And so I was responding to crises. I was in safety interventions. I was still acting as a therapist or a unit supervisor or working shifts. And so filling those different roles that were present. And so with that recognition, that's when I decided to take a step back. And so trying to manage a reasonable caseload in private practice, as well as I do teach a course as an adjunct professor, and then doing my doctorate. I just have to be very scheduled, and I have to be intentional. I think intentionality is incredibly important in any of the roles that we're in. I have to have set times that I'm taking to myself, or spending time with my children and my family, and setting those things aside, but not being on call all the time, and not going to work at midnight or things like that has definitely helped with self-care.
Great, thank you. And such good advice for students too, to start those practices early. So that as a student, you're learning how to take care of yourself, as well as doing your classwork and field experiences. Dr. Strobel.
I'm just going to point out the importance of having a mentor, because I've been fortunate in my life to have some really great mentors. And there's times where you're troubled with a case with confidentiality issues. You can't just run around talking to everyone about it, of course, but to have that trusted person who has more experience and can sometimes help you to step back and view it differently. I think that's really helpful for processing it. And setting those boundaries are important too, in terms of, after you've processed it, talk to someone, something that's weighing heavily on your heart, that you do leave it. You don't bring it home with you. Don't continue to think about it. Use some of your skills that you've learned therapeutically on yourself to distance yourself then from that. And then to make sure, like I talked about, that work-life balance. I mean, I do a lot of things to exercise, make sure I have good sleep, make sure, just like, Jess was saying, to not, do things at home that you shouldn't be doing, when it's work related, because it's eating into time for family. So just making sure you have those clear boundaries.
Yeah, definitely. That's a really good tip of being intentional about your time and setting those boundaries. So, Christina or Shelly?
I would say something along the same lines. It reminds me of when I worked as a therapist in a psychiatrist office for a while. Even though it was a great job, it was very consuming, and it was, taking me away from my family. It was one of those jobs where you couldn't leave your work at work. And I just had to come to that realization after a while that it wasn't a good fit for me as a mom. And, so I had to go in a different direction. Now it might be a good fit for somebody else, but I wasn't able to balance with that job. And like they said before, balance is so important. As much as you can, leave the issues of the day at work when you leave. It's not always possible, but as much as you can. And, make sure you take care of yourself when you're at home, and spend time with your family and your friends. And, I can't stress that enough, because it can become consuming. So, that's just something to watch for.
Definitely. Shelly, do you want to add anything to that?
No, I would, say, being intentional to take time off. Sometimes we feel like there's so much to do that if we take the time off, we take personal days, that when we come back, it'll just be that much more to do. But it's so important, to schedule that time off and take that time off for yourself. And in our field, I think we're so good at taking care of other people, but we're not always so good at taking care of ourselves. So, like Jess was saying, to be intentional about that. The kind of concept of team care and in your office setting and with your teammates, and watching out for each other, and talking about processing the incidents. Like Dr. Strobel was saying, having a mentor can really go such a long way to help you process those. I remember when I was early in my career that it was very hard. It did feel very heavy. And I do feel like I was taking that home a lot, and it it took me a little while to learn how to keep that balance. So it is so helpful to learn that early on and how you can do that, and spending that time with your family and your friends, and again, the eating regularly, even things like that don't take those kinds of things for granted, skipping all your meals because you're so busy, or just helps you with that. And getting good sleep and movement and all those things, I think, go a long way to helping you with that work-life balance.
Great, thank you so much. So again, if you guys have questions, put them in the chat. We'll be moving towards wrapping up in the next 10 minutes or so. But several of the panelists have mentioned the importance of mentors. And we do have a question that was sent in. What is something a mentor told you that really clicked or has helped you over the years? So I'm wondering if you guys can think of anything that you remember a mentor sharing with you that's been really helpful as you've moved through your education and career path.
Along the lines of the previous topic of balance and self-care, I had a mentor who, in calling me out, I think, indicated and kind of said, you can't juggle all the plates because then we don't know where the deficits are. And so in the franticness, and I can become very guilty of that, of I can do all the things and I want to do all the things and I want to make sure they're done correctly. And when you're dealing with, the lives of our children and families that we work with, you don't want a mistake to occur, but we're humans and mistakes do occur, or balls do get dropped. And so not taking on everything and allowing the gaps and the deficits to be seen so that they can be appropriately filled, because we can't as individuals do it all. And that sometimes is hard to hear, especially as a young professional, or you're trying to advance in your career. And there's, we receive a lot of praise for always being available and always being helpful and always being a team player. And those things are all well and good until it becomes a negative impact and it takes away from your personal life and your wellness. Because if I've learned anything, is there's not very many agencies or businesses or organizations who are going to prioritize my self-care over the bottom line. And so that has to be my focus and my priority. And so don't juggle all the things.
Great advice. Christina, did you have something to share too from a mentor?
Yeah, definitely on that one. It sounds so simple, but when someone said this to me a while back, it just clicked and it has helped me so much. They were like, you need to relax and enjoy your job. and I think, like Jessica said, you want to make sure all the details are taken care of. It's so important. We're dealing with people's lives and kids, and we want to make sure we don't drop the ball. But you can enjoy your job while you're doing that. You can relax and do that. So that just clicked with me. I was like, I do need to relax and enjoy my job, because if I do that, I'm going to be better for the people I'm helping. So that just sparked something with me.
Yeah, I love that. That's just that reminder to relax and enjoy. That's why we're doing what we're doing. So yes, Shelly.
I think, again, similar to that, it's, finding I'm told to kind of try to find the joy in every day. Some days can feel really stressful and heavy, but when you look deep enough, there's always something positive that happened, and using, that to keep you grounded and, just always choosing hope over despair.
Yes, perfect. And sometimes we have to make that choice, every day. So, Dr.
The one
Strobel.
that I remember is I was working on my doctorate, working my dissertation, and trying to get finished. And my advisor said, it's a test of endurance, not intelligence. Just stick with it. And I think this can be helpful for people, because sometimes you're like, can I do it? Am I capable? Can I do all this work? And he was just saying, just stick with it, take a day at a time. You can do this, keep working, keep working. And sometimes it does feel like a lot of hoops to jump through, but at the end of the day, it's so worth it. When you think about, oh, it takes 2 years to do this, but 2 years goes by really quickly. For some of you may not believe that, but it goes by really quickly. And then at the end, you have this degree, whether it's your master's or your doctorate, and it just opens so many doors. And I think that's what we keep saying today. There's so many different things you can do, but first you have to get that degree and stick with it. Just take it a day at a time.
Yep, that is great advice. Just recognizing when the real work is just continuing and getting the work done, and not getting stuck maybe in the minutia of the details all the time. So I think to wrap us up, unless we get another question in the chat, we have a few questions that relate to, how did you know which was the right field or which was the right area for you? And I just wonder, panelists, for the students considering a career in behavioral health, what would be your advice to them in terms of just trying to figure out the path to take, whether that's which degree to get, what kind of population or setting, any thoughts on sort of navigating that pathway?
And do what you enjoy. I took advantage of internships, even additional internships at an undergraduate level, and was able to do a military-based internship, but it was actually with adolescents and working through a youth center at an Air Force base. So I spent my entire summer between junior and senior year in Las Vegas. Very convenient timing and very fun. But taking advantage of opportunities like that, because, I thought I wanted to go into military social work. And it turns out I really liked teenagers. And so I stuck with that teenager population. And then I thought I wanted to do school social work, because who doesn't want the summers off? And then I got put into a residential internship and did residential for 10 years. And I never thought I wanted to be a therapist, but I actually fell in love with doing therapy. You asked me at the beginning of my master's, so I was like, heck no, I'm not going to be a therapist. I'm going to be a boss all the time. Being a boss is exhausting. And it's a lot of work. And so being able to have that flexibility of I think I'm going to veer a little bit. But there's always been that I really like teenagers kind of vein running through, and I like to be able to interact with that population. So any avenue that affords me that opportunity, I take advantage of it, and or with young adults. And so, take advantage of opportunities, do fun things, work at a Boys and Girls Club, or, try out the field that you might be interested in. I know I can't work in gerontology. I just know that. And so I see all the trainings come up, and I just really admire the people who can work with that population, and I praise them. But I know doing that or working at hospice or medical field, those are not my things. I can't do with hospital smells. And so knowing your limits and being okay with that, and then doing what you love.
Thank you. Great advice. Finding what you love, and then finding the way that helps you to do that. So, other panelists, sort of last advice in terms of just thinking about how one might choose their beginning of their pathway, because you've all been so clear about showing how there's many different roads that open up once you get started.
I would recommend some job shadowing. Go out there, somebody in the field, ask if you can come spend the day. You just can tell so many things from that, and then jump in there and try something. I think you just have to take that first step and see what happens, and other opportunities may come your way, or you may see you like it or you don't like it. I think you just have to get moving in that direction.
Yeah, great advice, and one that's been repeated here. Just take every opportunity that you can to see different things, because you never know what you might decide that you like.
And I think that's it. It is just, taking advantage of every opportunity, trying new things. If you find, like others have said, it's not working for you, don't be discouraged. Don't be hard on yourself. Find, what does bring you the joy, that you do connect with that work. And even if you think that you think what it is, and then you get into that and it really isn't a good fit for you, that's okay. There's so much need, and there's so, many opportunities, like we've said, that don't be discouraged and just keep working until you find your fit.
Yeah, that's what I would say too. Christina, one last words of advice as we start to wrap up.
I would say, along the same lines, don't be afraid to try different things. Like I mentioned, I've worked at all levels in the school system, and I know without a doubt that my place is in elementary. Other people feel differently, and I think that's because, we're all different. We all have different gifts, and, find what you like. Take the opportunities that come across your path, get as much information as you can, and don't be afraid to try new things.
Great. Well, thank you. I'd like to thank our 4 wonderful panelists for sharing their experiences and their wisdom with us from different settings and different professions. And I think it really added a lot to, understanding what it's like to work in behavioral health. So thank you all. And I'll pass it back over to Carolyn.
Thank you so much, Dr. Rischel. Really appreciate you moderating the panel, and big thanks to the panelists for being here today, for taking probably what was your lunch break to spend time with us and to give students your advice and wisdom. We are going to roll right into our next panel. And so I'm going to go ahead and share so you can see what's coming up next. Our next panel is going to be a case presentation. And the idea here is that you will be able to hear one scenario of a client or client family and hear from several different people that are practicing different types of behavioral health, what they would do with that case. And so I am going to go ahead and introduce our moderator for the panel. We have Robin Durham, who is an assistant professor of social work at Concord University, who will be moderating this panel.
Welcome, and glad everybody could be here today. So again, my name is Robin Durham. I'm an assistant professor with the Concord MSW program, and I have the pleasure to introduce you to our panelists, who will take about 2 to 3 minutes to tell you a little bit more about themselves and how they kind of arrived at where they are and the fields that they are. So we have Morgan Blatt, who is with Prestera Center for Mental Health Services. Elizabeth Walling, who's with Intentional Wellness, Melinda Price, who's with New River Community and Technical College, and Dr. Kevin Junkins, who's with Community Care of Bridgeport. So if you want to start, guys, in that order, maybe tell us a little bit about your path to getting into behavioral health.
Can we go ahead and start?
Sure.
Okay, well, good afternoon, everyone. My name is Morgan Blatt. And I am a certified TFCBT therapist and parent-child interaction therapist. I graduated from Marshall University with my bachelor's in counseling in 2011. And at that time, I remained in Huntington and began my casework as a case manager for Link Resources and Referral. And then I moved on to my internship at River Park Hospital, where I was trained in dialectical behavioral therapy. So I've been working with adolescents and children at different residential facilities. Since then, I received my master's in 2013 in mental health counseling from Marshall University. And I'm currently now, a licensed professional counselor, national certified counselor, and certified in trauma-focused therapy and the parent-child interaction therapy. So I've been working with children and adolescents now for the last 10 years. And I also serve on the West Virginia License of Professional Counseling Association board as the secretary and chairman of professional development. So I've worked in a wide variety between that and then also substance use treatment. That's where I kind of started after I worked with kids. I also worked at Presley Ridge and then spent the last about 4 or 5 years with Putnam County's Juvenile Drug Court program. And then I also worked with the MDIT team up there. So I've been trained in a lot of variety of evidence-based practices throughout the years. And I now serve as the program director for the regional partnership grant with Boone Canal, Raleigh, and Wyoming County. And I'm Prestera's evidence-based practice coordinator. And I also work with our regional youth service center and provide what we call crisis work with mental hygienes and do involuntary commitments.
Thank you. Elizabeth?
My name is Elizabeth Walling. I work with Intentional Wellness and Consulting here in Morgantown. So I had a little bit of a different journey through my health profession. I started off as a sociology student. I graduated from WVU in 2006 with a sociology degree and then went straight into grad school. Did not finish that degree. I finished all the coursework, but not my thesis. It happens sometimes. Started out as a professional doing research on a couple of research projects, worked as an internet crime analyst, moved to DC for a little while, worked on a research project at the Kennedy Center there. Also had a short stint as a sex education trainee in DC, came back and decided I needed to change my life a little bit. I knew that I always wanted to go into behavioral health. I always wanted to be a therapist, and it was time to do that. So I earned my master's in social work from WVU. I graduated in May of 2020. Didn't ever go to a graduation, as we all know. And I worked with the Center for Excellence in Disabilities for about a year and a half. Program. Modified program assists youth who aged out of the foster care system in going to post-secondary education. A lot of my experience up until this point has been working with teenagers in transitional efforts, turning into adults. During my time as a student, I was also in the LIN trainee program at the CED, which is Leadership in Education in Neurodevelopmental Disabilities. It's a multidisciplinary team, people from PT, behavioral health, other professions, speech therapy, all get together and talk about how to help patients that come into the center. So now I'm under supervision, working as a therapist, and working towards my independent license.
Okay. Melinda?
Everyone, I'm Melinda Price. I work at New River Community and Technical College, but I'm with the West Virginia Collegiate Recovery Network as the peer recovery support specialist. So what started all this for myself was I did volunteer work since 2006. And then in 2013, it opened up that I could do the Recovery Coach Academy. And so when I attended that training, I had decided that I wanted to pursue my education. So I started that, and I started working in an agency at FMRS Health Systems. And I worked with individuals with substance use disorders. And I have worked in the field since 2013. I became credentialed through the West Virginia Certification Board of Addiction and Professionals in 2014. In 2017, I decided I wanted to do more. So I decided to go back to school. And that's when I had went out of the field for just a couple years. And I recently, back in May of last year, received my Associates of Science in Social Services degree at New River Community and Technical College. So I've been at New River Community and Technical College as a student and now as an employee. I've just never left. And so now I'm presently at Concord University as a junior, working on in the social work program, wanting to become a licensed social worker. So that's what brought me here. And it's been an amazing ride and a great journey.
And last but not least, Dr. Jenkins.
Hey guys, thanks for having me today. My name's Kevin. I am a psychiatrist. So my past's a little different as well. I originally wanted to be a family doctor, good old general practitioner, and go back home and save the world. But it was in medical school that I realized that my true calling was psychiatry, because that's where you actually get to know your patients. And plus, people who work in behavioral health are really cool. So it's kind of where I fit in. And I had the good fortune of, after doing medical school residency and fellowship, of finding some good folks here in West Virginia to work with. I grew up in Grant County, and I went to a very small school. There were 23 people in my graduating class. I never even had chemistry in high school, and I started out at a community college. So there's my plug for you guys can do whatever you want. You just have to work hard at it and you can get there. I'm first generation college student. And, it's been really awesome to stay here. I knew I wanted to stay in West Virginia. My family's here. We've been here. So I found this program, and I see pretty much the full spectrum. I'll see kids, adults. I'm board certified in general psychiatry and child and adolescent psychiatry. So we'll see whatever comes at us. I also have, someone in the last panel mentioned about being a boss. I also have the fortune or misfortune, however you want to put it, of being an administrator as well. So I share an administrative practice. So I kind of help develop programs, but also see patients about half the time as well. So that's really important to me, because there aren't a whole lot of child and adolescent psychiatrists. So I really want to, continue to try to contribute to help things go, better for the trajectory of our state and to help folks who need it. I do a good bit of school psychiatry. So I actually get to go out and work in elementary and middle and high schools and provide services to people who maybe normally wouldn't be able to access them. So for me, that's really cool. So looking forward to talking with you guys today.
And I have to agree, mental health folks are just as cool as they can be. So yeah, it's all good. Okay. So what you're seeing on your screen, we have a case study, and I'll give folks just a second to look over it. And then I'm going to ask them just different questions. And kind of the cool thing about the questions is each person may have a different take just because of where they've come from in terms of education, work experience. So we'll give our folks a couple minutes to look at that.
Robin, in case there are some people on the call that are just audio, will you just hit the highlights of the case in case they can't see the screen to read the case?
Oh, absolutely. Yeah, let me move this out of the way here. Okay. So what we have is a 52-year-old female, and she's gone through divorce. She is working, that sort of thing. She's taking care of her grandson, which is a big thing we see in West Virginia, a lot of grandparents raising their grandchildren. 2 years ago. And one of the things that's happened is she also is struggling with a substance use problem currently with heroin. I mean, her daughter is, and that's why Sally has her grandson. She's been hooked up with Healthy Grand Families, and that's kind of an organization that's pretty cool about helping, support grandparents raising their grandchildren. She's under a lot of stress. She herself so she's got a daughter who has ADHD and who has a substance use disorder right now. She herself is dealing with diabetes and depression, and she just is having a hard time, with this adjustment for this, this grandchild. One of the other things that we're seeing is she's been able to kind of do okay financially on her limited income, but she has no health insurance. And so she can't get what she needs for her diabetes and depression. She can't afford to take her grandson for routine medical care, which we know is important for everybody, and kind of lives paycheck to paycheck. So one of the other things is that she's just feeling a lot of sadness. She's very concerned about her daughter, obviously. When her grandson was first born, her daughter was interested and really helped with his care. But now, since kind of the daughter's moved on with the boyfriend and is having issues herself, it's just not happening. The last time she visited Sally, she sold her credit cards and charged about $2,500, leaving her mother, again, who lives paycheck to paycheck, in a really bad spot. And what tends to happen is she doesn't, Sally doesn't confront Gloria because she's afraid she'll come and take Travis, just as whether retaliation, whatever. So with Gloria and her substance use issues with heroin, she's really scared. She wants to help, and she's afraid she's either going to overdose and she's going to lose her, or she's going to end up in jail. And so Ms. Pickens, Sally is feeling very, again, alone. She's overwhelmed, and she just doesn't know where to turn, basically. Okay. So, and again, I don't, as far as our panel, we can certainly just kind of go in the same order if you want, that you, or whatever, that you introduce yourself. But so if Ms. Pickens, or any of her family came to you for services, but maybe to narrow it down, let's start with maybe Ms. Pickens with Sally. Where would you start with her?
Okay, well, I definitely see working with Ms. Pickens, I would explain that even though she doesn't have health insurance at this time, Prestera could get her set up with the charity care. So I would explain that charity care process with her. And first, I would check into seeing if she's ever had Medicaid previously. So to do that, we would need basic identifying information. If she's ever had Medicaid, we would then run a presumptive eligibility to see if she would qualify for a temporary medical card. Those usually are good and last for about a month from the time that you've ran that. So if she doesn't, qualify, then we can complete that charity care application. And once this was completed, I would be able to get her scheduled with an initial mental health assessment to initiate mental health treatment. And then I also looked at it from just Travis's perspective here. I would encourage her to kind of get set up with birth to 3 services to help him with the developmental concerns. And I would also stress the importance of going to the West Virginia DHHR in her local county to see what services that would be able to assist, but also explain she's going to have to look into becoming that primary custodial guardian in order to get Travis the proper treatment he needs to address those concerns if she's not the custodial guardian at that time.
Elizabeth? You're on mute.
My initial reaction to this as a former social work student, now social worker, was to think of it as a caseworker. But my role here would be as Sally's therapist. So what I would start with would asking what she wants to gain with our therapy sessions together. And this is a trauma first practice. So that means that I would either rule in or rule out whether or not there's acute or chronic trauma. Sometimes things like depression, ADHD, generalized anxiety can mimic trauma. I'd also check what her ACEs score was, probably a stressful events interview to try to figure out exactly what's been going on in her life. Let's see what else. Based on her, in conjunction with that, I would focus on helping Sally recognize what her strengths are and recognizing what her boundaries are, reinforcing those and continuing to maintain those. I would consider myself a member of her health team, so I would ask her if she would sign a release of information so I could speak to other people and we could coordinate efforts. There's a lot going on with Sally and with Travis and with her daughter. And I think everybody knowing what's going on, everybody knowing everybody would help.
Melinda?
Well, as a peer recovery support specialist, I would need to see if she would be in need of peer recovery services to be able to be that resource broker for her. I would definitely connect her with Birth to 3. I could connect her with the local DHHR and help her to apply for any benefits that Travis or herself would be able to receive. I could connect her in the community with anyone that could help with utilities, the rent, any other bills, connect her with legal aid to help to attain some legal rights to Travis in the event, that if there was a medical emergency, she would have new rights to this little boy. And I can also, see if she could talk with her daughter, Gloria, to come see me and talk to me to see if we couldn't get her some help. But in a peer recovery role, we walk beside them. We don't tell them what to do. We're just that support. I could connect Sally to some support groups in the area, Smart Recovery, Family and Friends, Al-Anon, other, grandparents just like herself. You can see that, she is wanting some support because she connected with the healthy grand families. So.
Okay. Dr. Junkins?
I agree with what everybody has said so far. It's going to be the beauty of going last, but so many good ideas to piggyback on. But looking at this also from a physician perspective, I think one of the biggest things that, in addition to what everybody else has said, is with Sally, making sure that she knows that taking care of her own health is not being selfish, but is actually essential. I have the luxury of working at a fairly qualified health center, which is actually a primary care organization. So we're able to, we would be able to get her set up with a primary care provider. And we would talk to her about sliding scale fees or presumptive Medicaid, those sorts of things. Obviously the legal advice that everybody's been giving about what legal rights she has, can she start claiming Travis as a dependent so that, she can apply for food stamps or TANF or things like that. And how does she have some security knowing that, until her daughter's doing better and is in recovery, how can she make sure that Travis is going to be well cared for? So convincing her of that, we need to, obviously it says she has depression and diabetes. So we want to make sure we get her diabetes and depression stabilized, because if she's not healthy, then she's not going to be there to take care of Travis. So, we can work with our, there's federal pharmacy programs where, people that are uninsured can get their medications very cheap. So making sure that we're helping manage her diabetes and her depression and those sorts of things as well. And I kind of have an analogy that and this is a very common situation we run into, unfortunately. And so I have an analogy I give to folks, and it's kind of like, when you're on an airplane and you're traveling with a young child, if there's problems on the airplane, they tell you to put your oxygen mask on first, then you put your child's oxygen mask on second. And the rationale for that is because if you get incapacitated or you pass out, nobody's going to be able to put that oxygen mask on your kid. So that's where Miss Pickens is right now. She's in that situation where she needs to put on her oxygen mask, so to speak, so that she can take care of her child. And also you're just reinforcing that she's not alone. She's not the only grandma that's in this situation, that there are others in the situation. Healthy Grand Families is an awesome program that helps a lot of folks. So, and then from that, like Ms. Price said, making sure that she knows that if her daughter's ready for treatment, that we can help facilitate that, get her in the right direction. And then it doesn't say how old Travis is, but we definitely need to get him set up with a pediatrician so he can have his well child check. And the referral to birth to 3 and all that sort of stuff. So it doesn't say a whole lot about where he is developmentally, but we could do a developmental screening and get him set up, if he needs occupational therapy or speech therapy or whatever he might need from that standpoint.
Absolutely. And it is hard that I love the analogy. I've used it too. And it's hard to get people, because if you ask them, they'll just say, put it on the kid first. You're like, no. Okay. So I'm going to reverse it up. So for the next one is just, for what you're going to call an assessment, what would that include? And Dr. Jenkins, I'm going to start with you this time, and then I'll kind of work in a different direction. So what would assessment look like?
That's what I get for saying that, huh?
That's exactly what you get.
Well, first system. Well, so as far as assessment, we would definitely, start with an intake assessment of Sally. It sounds like she's the initial presenting patient here, and then we get referred. So, and since I'm a psychiatrist, I'm also going to do a psychiatric assessment, and I'm going to look at her general medical conditions, as well as, seeing how we can best treat her depression, while not forgetting about the diabetes as well, making sure that we have the right people there taking care of her as well, getting referred for those services. So a really good history and learning about the family, trying to figure out where she's at and what she's tried in the past. What has worked? Has she ever been treated for depression in the past? Or is this a new depression that we need to, has she ever tried medications? Is she willing to do therapy? Those sorts of things to see if we can get her pointed in the right direction. And then, I have child medicine psychiatrist colleagues. So if we need to, after after Travis sees a pediatrician, do we need to get him set up with one of those guys or what? But that's kind of where I'd start and what the assessment would look like.
Okay, Melinda?
On the assessment, I would not be on the clinical staff, so I would not be able to do any assessments unless it was Gloria for a substance use disorder. I would be able to do a recovery capital assessment, which would, look at the strengths, look at the barriers for her if she was, willing to be in recovery.
Elizabeth?
So I mentioned before, I would do the ACEs.
And could you tell people what that is in case they don't know?
Are kind of generic, which generally, oh yeah, your ACEs score, and sorry, I don't remember offhand what the acronym stands for, but essentially asks you about past traumatic experiences, how much adversity you've dealt with in your life, whether you, for example, were abused or witnessed abused, if your parents went to prison, or if somebody had a mental health condition in your childhood. And the theory is the higher your score, the more likely it is that you would suffer adverse effects from your past and to have experienced chronic trauma. Probably again do one of those stressful inventories or interviews. I have a lot of questions about Travis. It looks like he might have some developmental delays, may or may not know why. I would have questions about how she deals with that and maybe offer some education on how to help him, especially depending on what we find out when he gets looked at by physicians. I would also, in my role for her would be to help her understand how she copes and what her strengths are.
Mm-hmm.
And we would just spend a lot of time talking about that, how she handles stress, what her coping mechanisms are, how she takes care of herself, and find a more ordered way to do that, something that will help her heal while she's helping Travis and her daughter at the same time.
Okay. Morgan?
So during that initial mental health assessment with Ms. Pickens, I would complete the PHQ-9, which is a depression scale to assess for the depression, but also the depression, anxiety, stress scale to look at the, more in depth of her depression, anxiety, and stress levels to see what kind of treatment she needs due to the overwhelming stress that she's reported. I would also complete just a suicide assessment just to kind of see where she's at in regards to all of the mental health concerns that she's addressed.
Okay. So the next question, and really, I think some of this has already been answered. It just talks about what further information would you try to obtain. And what I'm hearing from you guys is you would really try to look at the picture in the biggest way that you could. There's certainly her initial complaints, but you try to gather so much more information about her psychological functioning, her health functioning, strengths, limitations, things like that. Does that sound pretty fair? Okay. And then based on that, also sometimes specialty evaluations, whether it be questionnaires, with psychiatry, looking a lot at like mental status sort of things, how she functioning in the moment, potentially referring for psychological testing. That sound pretty accurate? So just, and this is hard because we know very little. So just with this little snapshot, what interventions might be most effective for her? And let's start with Elizabeth. Shake up the order a little bit.
I'm sorry, keep doing that. So based on the very information, initial guess is something like CPT, which is the cognitive processing therapy. That would help her challenge her perceptions about any stressful or traumatic life events and how those perceptions shaped her beliefs and behaviors. The patterns of how she processes the past trauma and how that will become more clear. She'll understand them a little bit better and can change them. And utilize parts with internal family systems, and that will help Sally locate and utilize the parts of herself that can better address and resolve her conflicts, both inner and with the people around her.
Okay. Melinda?
Where I'm not on the clinical staff side of it, I would only be able to help Gloria in that aspect of being able to come up with a relapse prevention plan, a recovery wellness plan. The only thing that I could probably help Sally with is to help with boundaries within, Gloria, for her to be able to self-care in dealing with her daughter with the substance use disorder.
That's important. Okay. Dr. Jenkins?
That's a great idea, Emily. I mean, because there's some, whether it's intentional or not, some enabling here, if she's able to get in and try to, get in that money. Really, it's about, I would probably back way up and kind of meet her with some supportive therapy or motivational interviewing, just to throw her a life preserver, so to speak, to help her stay above water. But also, I think mutual support groups, so like Senator like Al-Anon or Nar-Anon, where there can be some of that mutual support for other families that are affected by substance use disorder, so that she can learn from others, and she won't feel judged, or she won't feel as if she's the only one going through this. And as well as the healthy grand families, definitely there are a lot of folks that are affected by substance use disorder in that program as well. So really encouraging her to use some of these programs to use the support network she's got, but really just kind of trying to meet her where she's at, use what skills she already has, and try not to overwhelm her initially moving forward.
Morgan?
So yeah, I would at first utilize motivational interviewing techniques to address her willingness to seek the custody. And the one thing too I'd be interested in knowing is how she handled that credit card theft, because it had said that, I would want to know if she had pressed charges over the $2,500. I would want to know more about her relationship with her daughter to kind of seek that custody. And I don't want to push her too hard, on holding her daughter accountable if she is unwilling to do, what is necessary. So I would just start with the motivational interviewing and really looking at those treatment goals with her to see what direction she wants to go in.
Yeah, and I think it's really important that, we absolutely start where the client is and where they want to go. The next one talked a little bit, so they were kind of together, interventions, therapeutic techniques, which I think you all covered. And so part of it sounds like too, we very much start with her individually. And I guess depending on how this goes, other people certainly could be involved, but definitely with her first. Let's talk about this one. And for this one, I'm going to start with you, Melinda, is what strengths are possibly there for the client and family?
Well, she has income, she has a home, she has neighbors helping with Travis while she's at work. She's open for support by contacting the healthy grand families. And you can tell that she still has a little bit in her to help Gloria if she would want help.
Dr. Jenkins?
I totally agree with that as well. I think just really trying to help her understand that where she's at, and these are some of the things that you can kind of do with it. But yeah, I don't have a whole lot to add from that standpoint.
Okay. Morgan?
Yeah, I agree. I definitely think her strengths consist of caring towards, has a lot of caring towards her family. She is employed. She's able to provide for that family, and she's conscientious of Travis's child development concerns. So I think all of those points are very positive.
Elizabeth?
It's pretty clear that she has a strong history of seeking out medical support and medical assistance that's and her having an ADHD diagnosis and receiving treatment for that. And she recognizes that it's a little bit more difficult for her right now, based on her financial situation, to access medical care. But that willingness to go out and look for it and ask for help is really, really important, especially in a state like West Virginia. A lot of people aren't willing to do that. So that's something that we really need to support her with.
Okay. Okay. Now, some of this we've kind of addressed a little bit, but now that we've been kind of chatting about it, I guess, are there other resources that you might refer her, either her or the family to? Because I've heard folks kind of rattle off a couple. Morgan, let's start with you on this one again.
Well, first, I mean, if she's coming to Prestera for services, I would let her know about Prestera's Health Home program to address those physical health concerns. And also to let her know that we have a primary care clinic with our CCBHC grant. So that way she could get all of her mental health and physical health concerns addressed in one location. I would encourage her to complete that Grands Families classes because it's a wonderful program. She's going to learn, there's going to be legal aid representation. There's going to be parenting in the 21st century and a lot of other knowledgeable things that she's going to learn out of that. I would also let her know about the AARP Raising Grand Family Support Group. I would make sure she was aware of LINK. So regarding the child care, there's nurturing parenting groups, but one of the important ones that I don't know about if a lot of people know about is the Family Strong Mosaic group, because that's a free online support group for families that have loved ones that are struggling with a substance use disorder. So that would be something, a good support for her. Also, the birth to 3 services, like I had mentioned earlier.
Okay. Elizabeth?
Yeah, off of that, all of those things, definitely seeking out some sort of childcare for Travis, seeking out group therapy sessions for Sally. My role in this as she could come to for support and a trusting relationship. And in that, I think the most that I could offer her would be space and time to be able to talk through the kinds of services that she's interested in, and even giving her time to reach out to those services while we were in session. Sometimes it's easier for people to do that, especially when they're overwhelmed, to have an anchor there with them who they trust. So that's definitely something that I could do for Sally.
Melinda?
I would connect them with, if they were eligible for Medicaid, I would connect them for the mileage reimbursement. They can get reimbursed for taking Travis or herself to the doctor's appointment. That would help, financially with the gas and, the care of the vehicle. But I would also connect her with services from Help for West Virginia in the event that her daughter may want help. They could, her daughter could contact Help for West Virginia. I could connect Sally with the 304 emotional support line. That could help her as well. The different varieties of nutrition programs, you could get her connected with a diabetes educator. Could help her, with her eating habits, with her having diabetes.
Dr. Junkins?
The only two things, and this is going to be, once again, I'm just piggybacking right off Melinda here again. But with the healthy eating, there are several programs around the state like Mountaineer Food Bank, but they'll provide fresh fruits and veggies. A lot of folks that are on a fixed income, or in some of our more rural counties might not have access to fresh fruits and vegetables. And if it's someone who, has diabetes, is on a fixed income, they're going to be eating a lot of canned or processed foods, which are not going to be the best for their diabetes. So getting that diabetes educator, but also getting the resources so they can hopefully get some fresh fruits and veggies, which is sometimes really hard to do. The best we can do. And the other thing I could think of too would just be referring her and her family for Narcan, making sure that they have Narcan available so they can reverse any overdose should Glory or anybody else come around, instruct them on how to use it. But aside from that, I think everybody else has covered pretty much everything.
Okay. So this next one, I'm going to start with you again on this one. So one of the things, and so, I mean, I get the feeling if everybody was on this interdisciplinary team, you would work well together. But, do you feel like your perspective on how you would assess her and move into treatment would be considered with other disciplines, if you had a different set of people that were in this interdisciplinary discussion? And if not, what might be some sticking points if you have other professionals working with this case? And Kevin, Dr. Junkins, I'll start with you.
that's the beauty of what we do, is a lot of what we do is an interdisciplinary team. And that's what I love about this, is that at least the way I practice, my opinion is just as valuable as someone else's opinion on the team, because we each do come at it from different viewpoints, right? So obviously I'm coming at it from a more medical standpoint. Everybody's coming at it from where their expertise is, and that's what they're bringing to the table, because none of us are an expert all around, and we can bring what we know and we can bring that to the table. I think that one of the things that, at least I hope in most behavioral health organizations, I think working as that team, having mutual respect, but also appreciating that, other folks may have a different perspective. I mean, the receptionist may see something in the waiting room that I don't see back in my office that may guide our treatment. I mean, so every member of the team is really important, and it's really important to hear what they have to say, because they do come at it from different perspectives. And that's what's really cool, because they may think of something I don't think about. I may think of something they don't think about, but then we bring it all together and it makes us all better to work as a team like that.
Morgan?
Yeah, I mean, I totally agree with kind of what he had said. I don't really have much to add to that. I mean, I feel like that coming from an MDIT team type of perspective, everybody is going to have their strengths, and, the main concern is just getting her and meeting the family where they're at, and, using a lot of just different motivational interviewing techniques and just different perspectives from a mental health point of view to address those depression and anxiety, and to meet the family's needs and to help them and decrease that, emotional distress. So I think that a lot of that everybody said, would be an agreeable thing if we were in an MDT type team.
Okay. Elizabeth?
Yeah, absolutely. I think that in a lot of the situations that I've personally been in on assessments for people in multidisciplinary teams, there's just been a really strong sense of respect and professionalism. I will say that there can be sometimes a thought that therapists and social workers in general may not be as necessary as some of the other team members. That's wrong. I think we all know that that is absolutely wrong. And that's probably where the tenacity that a lot of social workers inherently have would come into play. The truth is that we do a lot of hard work, and we do a lot of leg work, and we do a lot of the emotional work. Not only is that important, but it's required in helping families. So we're good ones on the team.
Okay. Melinda?
Yet experience to being a part of a treatment team. So it would really depend if the agency allowed peer recovery support specialists to sit on a part of the treatment. I do, as a, the way I look at it, I think it is important because of all the different pyramids, and how we all differently work in different ways, and combining them all together to be able to help an individual can only be beneficial.
Okay. One I kind of glazed over, but I want to come back to, and Melinda, I'm going to start with you on this one, is, we've got this kind of snapshot of this person and what's going on with them, but what might be some of the questions that would roll around in your mind about areas to maybe explore or that you want to know more about?
Glad you asked that, because I was like, oh, we missed that question. I would want to know if Sally maybe in the past had a substance use disorder. I would need to know more about her, because looking at Gloria, she's having a substance use disorder, some things are hereditary, and I would just need to know more information about Sally.
Okay. Dr. Jenkins?
And the big question I had in this was, it says Ms. Pickens is divorced, so I was kind of wondering about her ex-husband or her ex-partner, whether I'm assuming that was her daughter's father. Is he involved? How much of assistance does he help out with Travis? Some of that care. So, what other existing family supports are there?
Okay. Morgan?
Yeah, I would obtain more information about her prior history treatment to see if she's ever sought treatment before. I would want to know more about like her depression, anxiety. I would want to know about, panic attacks and just symptoms around the extreme stress. Totally, I agree with the ACEs and just see which points that she, what all she would score on that. So, and just her relationship overall with her daughter just makes me very curious. What's that been like? Because that's going to be a main thing going forward, especially when it works with, getting assistance for Travis. Because are they going to work as a team? And I would definitely want to know what her prior, the family relationship and dynamics are.
Elizabeth?
I would like to know all of that, but also a little bit more about her family of origin. How did her family cope with stress? What stressors existed in her parents' lives and her grandparents' lives that may have led to how they coped with things? Is there a history of neurodevelopmental disorders like ADHD in the family? Who else is presenting with symptoms like her daughter had?
Okay.
How was that dealt with? And I'm sure, how old is Gloria?
She is, Gloria, so I guess she's now maybe close to 18, 19, because she was 16 when she gave birth to Travis.
Okay.
I'm looking at that right.
And how long she had been out of the house and how it was, what interventions that Sally may had done in the past to try to get her help.
Okay. Okay. And just for me, coming to mind is, we have a little bit about, and again, I may have glazed over it, but we've got Gloria, but there's no mention if there's other, if Sally has other children and what those relationships are. It looks like she has a support system with a neighbor who babysits, but what does her bigger support system look like? That sort of thing. So yeah. Mm-hmm. Okay. Morgan, I'm gonna come back to you for this one. So what, one of the things we don't like to think about, but we have to, is, what barriers to treatment might be present here?
Well, I definitely would just want to know, the willingness to take the steps to address the mental health and physical health needs. And maybe she's possibly not ready to go through the steps to gain guardianship of Travis because of, she wants to keep that peace between her daughter. And that's going to be, like I said, and I agree with what Elizabeth was saying there about the family origins and just, what does the whole family dynamic look like? So that could definitely be a barrier. Other barriers could just be employment. Is she willing to get off work and make time for her mental health treatment? Is she willing to take time and, put on the oxygen mask, right? And go through the steps needed for that. So there's a lot of things that she's going to have to do because it's a lifestyle change. And one thing that I love is Marsha Lanaham, who is the founder of DBT. One thing that she always, a little metaphor that she uses is about the wheel. You could be driving down with a flat tire. Have you accepted the flat tire? Because you have to accept that you have a flat tire before you go change it. Mm-hmm. So, she has to really be ready to acknowledge that there are these problems and I'm ready to go change those, and make change. And so that would definitely be the barriers. And what I would like to kind of know is just her overall willingness.
Okay. Dr. Jenkins?
I hadn't heard that analogy before. I really like that. Let me just say that. I think a lot of folks I work with are like, what is that noise? They didn't even realize they have a flat tire. So, but something's wrong, but they're not sure what. It really is, I think, it's just going to be really, there's only 24 hours in a day. And this is in essence, a single mom, a 52-year-old single mom to a toddler. Who's probably going to need to go to bed at 7 or 8. And if depending on what shift she's working, where do we put the therapy? Where do we put the Healthy Grand Families program? Where do we put all these things that we want to do? So I think that's going to be a really big barrier. Depending on where they live, is transportation a barrier? West Virginia, that's a huge barrier. Hopefully we can overcome the financial and the insurance barriers. It sounds like we've put forth some good ideas for that, but just her willingness to accept the help. We can make a great plan, but if she's not ready for that plan or not ready to accept that help or not able to accept that help, then it's kind of all for naught then at that point.
Okay. Melinda?
It was just like what everybody else has already said. I had looked at the barriers of, her having to miss work, to go to the doctor, daycare for Travis while she was going to doctor's appointments. And then the, not having legal guardianship over Travis and that being a barrier of taking him to the doctor if there was an emergency, taking him to the hospital or anything like that and having no rights.
Okay. Elizabeth?
All of that. I think initially my concern would be whether or not she would be willing to take an antidepressant if it was something that she had consistent access to. Given what little information we have about the family, is like probably a pretty safe bet, but a good bet that she would be willing to do so. But the assistance that I would help her with, for therapeutic interventions for depression really need both those aspects. They need medication and then they need the therapy side. My first concern would be that.
Robin, can I add something I forgot to mention?
Absolutely.
I hope none of my DHHR fans on here get upset, but there is, some folks have a fear of CPS and DHHR. So when they come into a setting like this, they may be afraid to talk about that, Gloria is AWOL. She doesn't know where Gloria is at because she may be afraid that they may take the kids. So she may just, kind of want to keep that quiet on the down low. She doesn't want to talk about that a whole lot out of fear that someone may take Travis. So some reassurance that, we're actually here to help. The state's here to help. These programs are designed to help you. It's what it's for. Don't have fear to accept these programs. They're not going to take, they're not going to take Travis away from you, but the program's actually designed to keep families together. So make sure you're using those programs and don't have the fear of them.
Yeah, and I think you're absolutely right, because people have a fear because of what they hear, not necessarily what they know. And that's absolutely right. And another thing, I don't know if you all are seeing this when we talk about barriers, many of the times, and I've only lived here, so I don't know if this is only a West Virginia thing, but people tend to still have that belief of you got to do this, pull yourself up by your own bootstraps. If you ask for help, you're weak. And I was listening to a book not long ago where it says, that's all great, but not everybody has bootstraps. So, I mean, are you all seeing that in terms of help-seeking behavior? And anybody can jump in on that one.
Yes, absolutely. That's overcoming stigma is a huge issue here in West Virginia. And I've only practiced in West Virginia, so I can't speak to other areas, but it most definitely is. There's this idea that accepting mental health treatment is a lack of faith, or it is a moral failing, especially folks. There's a lot of stigma about folks going into substance use disorder treatment, and a lot of judgment. And even within our behavioral health community, there's a lot of lack of agreement on how best to treat those folks, and stigma within our own community about certain types of treatment and that sort of thing. So it definitely is a huge barrier.
Yeah, I think that's where advocacy on our part come in, and that can be even at individual level. So I've had clients who have been minors or close to minors, and their family members either don't believe in mental health problems or don't believe that they have a mental health problem. And it can take a lot of work, both on the client's part and my part, to say, hey, look, this is what's going on. This is how this is treated. Let's try. it's important for the client in a situation like that to have somebody who is their advocate.
So the last question is, it's a two-parter, and I'm gonna flip it around, because it says, you know, in what ways could we advocate for the client, but then it's what changes are needed within the system. And I feel like, you know, changes are where we need to potentially advocate. So as far as here, West Virginia, we work here, what changes might be needed in the system that would help support her getting help and working on what's going on? And let's start with Elizabeth on that one.
I think in terms that would help me the most, and in my past experiences, what would have helped me the most is having access to other members of the care team, and the other members of the care team making sure that they're listening to everybody else on the team. A lot of times emotions can run really high. We want to help people so desperately that anger and frustration can come at people on the care team when it's not appropriate, or maybe they don't have the whole story. And we really need to remember as behavioral health professions to really listen to each other and to act as teams to help our clients and to not fight each other so much.
Okay. Morgan?
Well, I have a lot to say on that topic, but this is one thing that I will say about it. So I am the program director of a grant that's called the Regional Partnership Grant. And what the grant is, what we do is we help those that have an open CPS case and an identified substance use disorder to help regain reunification back. So I really believe that with programs, and what we do is we get our referrals through DHHR, CPS DHHR. So we work collaboratively with DHHR, and that's been a phenomenal thing. So collaborate. And the one thing too, I will say is that during this project, we did a collaborative inventory and, you know, put it out to a lot of different agencies all throughout the state to kind of get their inputs. And one of the questions on there was collaboration would, you know, be improved if there was more meetings focused on the child and the family outcomes rather than the individual program updates. And 70% of people agreed with that across. And so I really am a true believer in family treatment courts, and I'm a true believer in just the family systems approach altogether. So that's one thing. The other thing that was really interesting though, and it shows you how far we still have to go around the stigma, is that on the study or on, you know, the inventory that we had done, one of the questions on there was medication assisted treatment, prescription drugs that treat opioid addiction should, you know, be made available. And you know, a lot of people disagreed, like that there's a lot of people in the field that still disagree with MAT treatment. And 77% also agreed that there is a stigma associated with addiction that prevents parents from seeking substance use treatment. Right. So I will say in closing on that is that we have a lot of great programs that are trying to collaborate together. And, you know, and I've had the great privilege of, you know, learning about Help for WV. I've hope for, the West Virginia Collegiate Network Recovery, because they've been a phenomenal partner in this, and just the Vance Family Services and other foster care agencies. So the more we can collaborate and work on the families, then the better I think that we're going to see improvement. That and the family treatment courts, because I can never say anything more positive about than the family treatment courts.
Okay. Dr. Jenkins?
I think that definitely all I do is piggyback off people. But from Morgan here, we have a really hard time with the legal system sometimes, especially with folks who have substance use disorder, and we'll have judges or whatnot that tell folks they can't use medication assisted treatment, or they have to do X, Y, or Z, or we have advocates within the community who are spreading what I'll call disinformation about substance use treatment, or they are, they're just really not evidence-based information that they're giving folks. And that really does set us back, and it makes it really difficult. And it does lead to this stigma. But also, the reason that we're all here today is to help convince folks to come into the behavioral health field, because I mean, that is the biggest barrier here in West Virginia, is we don't have enough of us. And I mean, we need 15, 20 more therapists. I mean, it's just, we can't keep up with the need. And that's why, and we need folks like y'all that are on this webinar today to really become passionate about this. And if you are really interested in making a change, I think pretty much everybody on this that's been speaking today would be more than happy to talk with you or mentor you or point you in the right direction about how you can become what you want to be and help other people, but also help change the trajectory of West Virginia, because that's really what it's all about. So, but that's our biggest barrier, is having the people to do the work.
Melinda, anything that you would add about changes that are needed in the systems? And we got a couple minutes left here.
No, I really don't have no comment. It takes us all, to be able to help individuals, all of us, all of our, career paths that we're in, like Kevin had stated, we do need more people in the field. We can never have enough. We have some that gets burnt out, because they lack self-care, and then they're just not in it. And so it's nonstop that we all have to be together as a team and partnership with one another, just like Morgan had said, about collaborating, and we need that. And, we need to break down the stigma, in order to help individuals, because, when there's so much stigma out there, somebody will not ask for help because of the stigma.
Yeah. It's always interesting to me is, we know our head's connected to our body, but somehow people think it's different when it's mental health, and it's not. So I just want to thank you guys. You've been, excellent. Some just really great input. I hope that the people listening exactly know that, again, we need mental health professionals in all settings. So again, thank you for your expertise. And Carolyn, thank you for asking me to be on the panel.
Thank you so much. Really appreciate all of the panelists and your time, Robin. Great job moderating that panel. It was just so good to hear from each of you and your perspectives. And thank you so much to everyone who is on the call. This is being recorded again, and so it will be able to reach a lot of students who are considering a different pathway in the behavioral health field. And so thanks again, everyone, for your time. We will be back here tomorrow. There's a different link for the Thursday call, so check back to your Eventbrite email notification for the link to join tomorrow. We'll be starting at noon, and we'll have 3 panels going from 12 to 3 o'clock again tomorrow. Those will also be recorded, and we look forward to seeing you all. If you won't be joining us tomorrow and you don't mind to take the evaluation, I'll put that back in the chat, and you can scroll up and find that link to SurveyMonkey. Really appreciate everybody. Have a great afternoon. Enjoy the sunshine if it's shining where you are. Thanks, everybody.